Hi, my name's Margaret Heel. I'm a wound, ostomy and continence nurse specialist. I work in southeast Vermont and I have a wound care business here, Heel Wound Care. And there's a website, heelwoundcare.com. And I'm here today to talk to you about a method of pouching called the cardboard tube technique. And it's specifically to apply a wafer even when there's persistent output. And that's really the key, because when you've got persistent output, it's very difficult to keep the skin clean and dry. So all you need for this technique is an index card and your normal kit that you take to the bedside. You get the card and you make it approximately the right width that you need it for your patient. And then you just bend it. You can do that just by running your nail down the card and curving it a little bit. You don't want the card too long, so if your patient has a small stoma, you may need to cut one edge. Tearing this edge is important because it makes the edge soft and it conforms to the skin better and actually becomes a little bit absorbent, which is great. So you're going to make the tube and fit it around the stoma to make sure that you've got it the right size. You can then put a couple of pieces of tape on it. The other thing you need to make sure is that if you're going to use this as a guide or a slide, that it actually fits through the wafer. And you can use the wafer to make the tube the right size if you want to. Once you've made the tube the right size and checked the wafer, you're ready to start. You need to make sure that you've got some tissue. You can either make tissue wads, but they're not going to absorb very much. So what you can do is just stuff tissue into the tube once it's in place. If you're using this for a urostomy patient, then I would put the tissue in very tightly. If it's for a patient with an ileostomy, it should be more loose. So as you can see, this patient's a urostomy patient and there's urine coming out from the stoma. All you need to do is do a quick cleanup, put the tube in place, and then stuff it full of tissue. Now you can spend as much time as you need to clean around the stoma and make sure that it remains dry. Then what you're going to do, once everything's clean and dry and you've done your ostomy care that you need to, maybe you've done some crusting for some soreness around the stoma, you can use a 1-piece or a 2-piece, and what you need to do is to use this as a slide. So you put the pouch over, make sure everything's angled the way you want it. Then you need to make sure that there's been no leakage while you've not been looking. Dry again underneath. Take the backing paper off and then press down and press into place. With a 1-piece, what's going to happen next is that you're going to knock off the cardboard tube and take it down the bottom of the pouch. Now this obviously won't work with a 1-piece urostomy pouch, but you can do it for an ileostomy patient. So that's using it as a slide. The other way to use the cardboard tube is to use it as a guide. And in that case, you would actually do your peristomal skin care and everything that you need to do, get it all ready. And if you need to, you can use a cardboard tube for that. But you'd use a separate cardboard tube to actually place the wafer. So you put the cardboard tube through the wafer, take off the backing or tear it in 2 places. And then what you've got is something that you can use, or the patient can use, to actually place this correctly and accurately. So the patient would take it by the tube rather than by the wafer and place it over the stoma. Then they can take a mirror and check underneath to make sure that everything's where it needs to be. And then, if they need to, they can take off the backing paper that they've already torn, or they can just slide it down. Now, if they're going to do this, they can't be using paste or caulking very close to the edge because it will catch on the cardboard tube. And then they just remove that and put their pouch in place after taking off the surround. So next I'd like to just read a list of hints and tips that will help you to get this right first time and to be organized when you go to your patient. So this technique can take time and appear really fiddly. So make sure you've got what you need and be organized before going to the bedside, especially for the first time. It's sometimes helpful to leave the backing paper on the wafer, taking it off after sliding the wafer over the tube. To do this, the paper backing needs to be torn in a couple of places. Some wafers have plastic backing material, and this will need to be cut or removed. The problem with the plastic is that it can actually cut the stoma, so you do need to be careful with that. Press the wafer into place for a full minute or longer. Do not rub it, as the shear created shreds the adhesive. Make sure to pinch up some pouch material so as not to flatten the stoma and force moisture under the wafer edge. If using paste on the wafer, it may stick to the cardboard tube, so keep paste away from the edge. Pack tissue wads into the cardboard tube tightly for urine and more loosely for thicker output. Have replacement tubes and wads at the ready for urostomy patients. It is possible to use the cardboard tube technique with a one-piece colostomy system, as the tube can be allowed to drop into the pouch and be removed from the bottom. However, this isn't possible with a one-piece urostomy pouch. If the stoma is flat, more pressure is needed to keep the tube in place. If the skin is very sore, pressure from keeping the tube in place can be painful, but moistening the end of the tube and dipping it into some stoma powder before pressing it onto the skin reduces discomfort. Warming the wafer before application can still be done, as it helps adhesion. The cardboard tube technique works with round, oval, and irregular shaped stomas. This method of application can be used with convex and ultra-thin wafers. This technique can be used by somebody who is totally blind, providing the stoma is an outie, or they can discern the mucocutaneous junction. Managing fistular output during skin treatments and wafer application can also be easier with the cardboard tube. It is possible to use a strip paste or tape to hold the tube in place while managing fistula problems. Lastly, before I finish, I'd like to show you one more thing. It's possible to actually use a cardboard tube in a different way. And to do this, you'll need either a toilet roll part or maybe a lid from a detergent bottle. That works very well, especially for large stomas. Once the actual wafer is in place, if you pinch a crease in the pouch and place the larger tube over the top of the stoma and press, you get a really even pressure all the way around the stoma. And this will help with adhesion. It's a very, very good way of making sure that people don't rub the adhesive on the wafer. As I say, you can also use a cap. I hope that this technique's useful for you in your practice and part of your toolkit. So I end my cardboard tube technique with just saying thank you very much for watching, and I hope that this is a very useful part of your toolkit. Thank you.